Hello. Wow. This is so fantastic to be having this conversation. I am Dr. Catherine Hansen, and Pandia's head of menopause, board certified obstetrician and gynecologist. And we are here to be talking about menopause and the business case with MiDOViA CEO and co founder April Haberman. April, I will hand over to you to share a little bit about MiDOViA.
Great. Thank you. Thanks so much for having us today. MiDOViA's goal, really, Dr. Hansen, is to strengthen businesses with our expert menopause-friendly workplace solutions that really bring about that long-term sustainable cultural change. We do that with e-learning. We do that through our membership and accreditation program, which is the only one in the US currently, through training, education, policy guidance, and consult and other resources.
Amazing. Thanks so much for that. And we're going to be unpacking a lot more about what MiDOViA does. Pandia offers menopause solutions for women and for workplaces. And as a telemedicine company that is doctor-led, women-led, women-founded, it is a really credible source and resource for women, for women personally and for their organizations. So as we get started with this conversation, I just want to make sure that people know that they can put questions in the chat box. We're going to be taking questions at the end. We're going to be talking for approximately 20-30 minutes, and happy to pop over to questions and interaction as people wish for us to do that. And also want to share that Pandia Health has a sign-up page. drcatherinehansen.com has a sign-up page, so places that they can stay in touch with us. And how about MiDOViA? What would be the best way for people to stay in touch with you?
Thanks. MiDOViA.com. It's super simple.
Awesome. Okay, let's dive in. So we know that menopause is gaining steam in the mainstream media. And I notice for myself as I'm immersed in the menopause space that there are people who are in the know and really a lot of conversation. And I think that's probably how you feel as well. But I'm also noticing, especially in the clinic and in some workplaces that I work with, that there are people who are unaware of menopause and how important this education and information is. And in fact, sometimes very taboo, very stigmatized,
Right.
and hush hush kind of, can be really embarrassing for women, especially midlife women who are going through these changes that are confusing for them at work, confusing for them in their bodies, confusing for them at home. So I'm just going to share just off the top what menopause is, because it's surprising to me, people still aren't totally aware of that. And then let's talk about why it matters.
Yeah.
So menopause is essentially the cessation of cyclic menstrual periods. So it's that 1 year anniversary of not having a menstrual cycle. And in that time frame leading up to that, there can be changes that are happening in a person's body and menstrual cycle, and many, 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 many symptoms, some of which we document and talk about, and some of which are quite vague and somewhat confusing. And those symptoms can occur for 3, 5, 7, even up to 10 years. So we're talking to women who are mid 30s and beyond. So we're talking about a huge demographic in the workplace. And so I'll hand over to you. Why do we care about what menopause is in the workplace?
Yeah. Thank you for that. And I will also add to that, we have a large population of women that are moving through the menopause transition. They're in one stage or the other. And the other 50% of the population is affected by menopause indirectly.
Right.
So menopause really affects everyone. So this is an important conversation for women, for men, friends, mothers, colleagues, spouses, you name it, right? So that's first and foremost why we should care. And I will say, I've worked in the menstrual health and sexual reproductive health space for over a decade now. And the conversations are around menopause are definitely becoming more commonplace, but there is still a lot of stigma that surrounds menopause. And menopause is understood. So I'm glad that you started with a little general information about menopause, because you're right. the majority of people that we bump into don't have even basic knowledge around menopause. So there's still a lot of misconception and myths around menopause that we need to start breaking down, so that education is important so that we begin to normalize the conversation around menopause. Why do I care? Because I am one of those women, right? We are those women. We
I'm with you.
here in menopause, right? So of course we care. And I want, when I look into this crystal ball and I get up every morning, what motivates me is really envisioning a world where we can have healthy conversations so that our relationships are stronger. That, my daughter, who is 21, has a better experience going through menopause when she hits that perimenopause stage, and has enough knowledge and education to know that there are things that she can do even before she starts perimenopause that will help her post-menopause. So there's a whole health spectrum that we're talking about, not just the time period that we enter perimenopause for the rest of our lives.
Yeah. April, I just want to say thank you so much for bringing the men into this conversation. So, as an obstetrician and gynecologist, I will sometimes forget about the men, but they are, again, the other half of the population, the
Sure.
other part of our demographic, and so directly and indirectly impacted by menopause, both in their homes, in their communities, and in their workplaces. And so, thank you for bringing that in, and knowing that so many men that we interact with are really desiring tools and resources to be able to support the women in their lives and in their workplaces, in a more fulsome way. So I
Mhm.
appreciate that. And I also love, and this is what I love about MiDOViA and you and your co-founder, Kim, is the vision that you take for how we can change this conversation for future generations. So
Right.
I'm always inspired by having these conversations with you and what MiDOViA is doing to really roll things forward, because as we try to move the needle for men, for younger women, and for menopausal women as ourselves, really working together to do that is impactful and deeply inspiring.
Thank you.
So let's shift over to some of the workplace and societal factors that contribute to these challenges for women. So we've talked about symptoms for women
Mhm.
themselves. We could unpack that all day long, and
Yeah.
that could be another
Mhm.
conversation. But there's a lot more to it that we want to bring into this conversation around menopause at work.
Yeah, there's a long list, and you're right. We could talk about each and every one of them in a separate webinar, but I'll start by just reminding listeners that we just mentioned stigma and
Mhm.
shame that surrounds menopause. There is definitely silence and lack of open conversation, and that's getting better. We're starting to see a lot of celebrities that are talking about menopause, bringing it forefront and really pulling back the curtain on menopause. But we're still not talking about it in the workplace like we should, to normalize that conversation, to ensure that we have the right support in place for women in the workplace. So there's a lot of ageism, a lot of stigma that's associated with it, but there's also a lack of education and awareness. And you started with that comment when we started this webinar, and it's so true. Women themselves have a lack of knowledge and education around menopause, but in the workplace in particular, what we're finding is that not only is it general lack of knowledge about menopause, but really that understanding on how it affects the workplace. When someone is suffering through menopause, how does that affect everyone within the workplace? So that training and education is really important. There's also lack of policies, accommodations, and flexible working environment that can support women. If there's not a policy in place, there's not a guidance document that women can fall back on. If they don't know that they can take time off to go see a healthcare provider to take care of those symptoms, that becomes troublesome. And if there's inflexibility in the workplace so that she can actually take that time off, or she can maybe sleep in an hour later if she's having trouble sleeping because of hot flashes, or maybe she has heavy flooding bleeding and she can't leave the house. That was me. I went through early menopause. I had heavy flooding bleeding. Fortunately, I had a very flexible workplace that allowed me the capability of staying home and caring for myself until I could get the help that I needed. But if we don't have that flexible work environment, what we're seeing is women drop out of the workforce. They have no other choice but to quit their jobs or maybe decrease their hours. Maybe they don't put their name in the hat for a promotion. And then there's a cascade effect there with the financial consequences that happen with that. So it's not just immediate, the here and the now financial deficit that we end up seeing, but it's long term too if she's not planning for retirement. So again, there's this long runway that we're looking at. It's not just here, what's right in front of me here and now. And I also think that we're in a midlife sandwich generation when we're going through menopause. So, here we are, right? Possibly caring for aging parents, possibly still have children at home that we're caring for, or maybe they're empty nesting. And here we are with all of that emotional chaos happening, right? We are at the peak of our careers at this age. So we really do want those promotions and we really do want to do well in our careers. But you throw in menopause and we have some of those menopause symptoms that prevent us from doing that, and chaos happens. So there's life that happens, for lack of a better way of saying it. Life happens, and you throw menopause into the mix, and we're trying to juggle all of those balls. And then I think I'm going to pass this back to you to maybe talk about the fact that we have limited access to healthcare providers. Lots of organizations don't cover menopause care, and there's a lack of medical training. So I'm gonna hand that back to you because you know more about that than I do.
Yeah. Yeah. And I just, first, before getting to that, love so much what you're saying about the natural rhythms and really the human experience. And if we had more human centered workplaces and we could allow that ebb and flow, there is absolutely no doubt we would have improved productivity.
Absolutely.
And I think that finally people are starting to crunch the numbers to see the dollars and cents.
Mhm.
Honestly, between us, it's a bit sad that there needs to be a dollar figure attached because we're talking about human lives. We're talking about mothers and sisters and partners and grandmothers. We're talking
Right.
about women. But when you attach the number, I think businesses and leaders really realize how important it is, compassionate, but also important it is economically to start listening.
Yes.
And so I just want to share, a couple of numbers that are coming out of the reports we're seeing in the US, $26 billion annually in lost productivity
Mhm.
from that demographic, and 1.8 billion in sick leave due to menopausal symptoms.
Right.
So they're actually, and these are underestimated for the reasons you talked about before, where people are hush hush, they're not
Right.
open dialogue, they're not having conversations. So we know these numbers are
Mhm.
probably small, but they're massive
They're
amounts
massive.
of ROI. Yeah.
Mhm.
And just for the sake of understanding that people are different and have different needs and different supports. Not that they want to work less. In fact, women at the age and stage of life that we are at are ambitious
Mhm.
and aspirational and visionary and starting to sort of set down some of the things that have been holding them back professionally for so many
Right.
years. Children are starting to take care of themselves a little bit.
Mhm.
Maybe they're out of the house, like you say. And so these women are wanting to get those promotions,
That's
and
right.
yet held back purely because of the confined constraints of a system that they're working within that wasn't built for or by them.
Right.
So
Right.
I appreciate all that you have said. I'll give you a chance to reflect on that before I switch back to what you asked me about limitations in healthcare.
Yeah, I will just add to that, yes, we want to thrive in our careers. And we are in a place where we don't have those same responsibilities that we had before. So we do have more time to give to our career. And I think that oftentimes we look at the runway, and the runway is a little shorter, right, than it was. And we want to make a difference. We want to make an impact.
Right.
So now really is the time. We're thirsty for it. And what we also see is senior leaders within organizations who are at the top of their career are very, very isolated and lonely.
Mhm.
It's still very male dominated in senior leadership roles, and even more so for some minorities. So it's
Yes.
very, very lonely. It comes back to the fact that we're not talking about it, we're not having the conversation. And again, you add that layer, and it's really sad that we don't have the support within the workplace, especially for women that are at the top of their career.
Right. And I sometimes think that women who that I've seen, in workplaces are feeling like they can't say anything because they'll be seen as whining or not wanting to work or just asking for more than they deserve.
Right.
And what you highlight and what I hope our listeners are hearing is that we know women are at the peak of their professional career. They're wanting to leave a legacy, as you
Right.
described.
Right. Right.
And yet feeling very, very isolated. And as you alluded to, women of color, our LGBTQ2 plus communities, they are even more isolated from an already isolated area of being traditionally marginalized populations. So I think
Right.
it's important for us to raise up all of these vital conversation pieces.
Agree.
And you mentioned, why is it that it's so hard to get menopausal health care? And I see women in the office weekly, regularly, and I have women who receive that care, and then they literally say, I wanna hug you. I wanna celebrate you. I'm so glad someone finally heard me. And each time that happens, it reminds me that that care is lacking.
Mhm.
And why is it lacking? So a decade at University of Texas Medical Branch, a decade educating residents here in Texas, and realizing that it's not necessarily part of the structured curriculum. Now let's be real. Residents have a very limited amount of time to learn a very large amount of information, and a lot of that is emergency obstetrical emergencies, saving moms, saving babies. A lot of that is surgical skill. A lot of that is learning algorithms in terms of being able to do the things that have to be done quickly and fast. And residents need to learn that, and we all want them to
Mhm.
learn that. When it comes to managing midlife, managing menopause, really learning the medical aspects of the physiology of the changing female body, it takes a slightly different conversation, and there's not necessarily built-in aspects of a program for that. Now, I hear people saying all the time that it's not in residency programs. It actually is in residency programs, but it's a matter of hours and
Right.
time where people are spending their time training. I've seen a lot of residents coming up more recently who are really seeking and thirsty for
Right.
that knowledge.
Mhm.
And I think that that's amazing.
Mhm.
It's important. It is another huge conversation item, but just to highlight, it's really important to realize that when women are seen in a medical office for menopausal care, it's really not remunerated by insurance companies at the rate for which other things are. So I learned very early in my private practice career that talking to patients is what pays the least.
Mhm.
And
Right.
so
Right.
that's fine if you're not, looking to be rich in a medical practice, but it's really hard to keep the doors open. So
Right.
you've got to pay your staff and you've got to pay your overhead. And I mean, these are all the nitty-gritty logistics of running a business. And really sadly, looking after women in that way of creating space and really being available for them in conversation is there's not a lot of space for that in
Right.
in the U.S. healthcare system, where it's a service based model.
Mhm.
And so we see cropping up all over the place more privatized menopausal care, more
Right.
specialized menopausal care, and ways that women can get menopausal care that is, credible,
Mhm.
guideline based, and sometimes that requires paying a little bit out of pocket, or sometimes that requires really researching and searching where to find that type of care. So,
Mm.
um, Pandia, for example, is a
Mhm.
telemedicine company that offers that convenient, easy access care for women in midlife. It's always a physician who's reviewing the assessment. It's always a physician making the decision. And it's a really high level of guideline-based menopausal care that's available for women. And I know MiDOViA is doing phenomenal things to open the dialogue around this conversation and providing support and resources in workplaces. I'd love for you to unpack what that looks like.
Yeah, yeah. Thank you for all of that. I think the evidence-based care is extremely important, and to your point, it is each person is individual, and we know that every person has a different experience with menopause. It's not cookie cutter. We can't treat every woman the same, so that that held care, as I call it, is really important. So we're thankful for what Pandia is doing. And one of the things that we do in the work that we do with organizations and come alongside them, one of the first things we do is to really unpack what benefits they already have in place, or to help them to understand if menopause is already covered with their current insurance program.
Mhm.
Shockingly, a lot of organizations don't even know that, even HR professionals. So that's the first place that we start. Do you have menopause support? Can your employees get the care that they need? Because ultimately, that's what we want, right? We want individuals to be able to get the help that they need so that they can return to work or come back to work at full capacity and thrive. So benefits are really important, and it's a piece of what we do. What we find, though, is that organizations are lacking the knowledge. So typically, what will come in after reviewing their benefits is to provide that education, those awareness sessions across all levels of the organization. And that's really key to ensure that everyone within the organization has the same knowledge and understanding of menopause, so that managers can have conversations with employees and they're comfortable doing that, male, female, across the board. Employees are comfortable having conversations with managers, HR professionals, and the like, and that conversation becomes normal. So we're normalizing the conversation with the
Mhm.
education and training, and to have leaders kick off the initiatives. It's really important that it comes from senior leadership as you're rolling out menopause support programs in organizations. Kim and I were just talking to an organization this morning that is our first accredited. We can't announce that yet, but we just accredited our first organization.
Congratulations
And
to that
thank you.
organization.
Yeah, they've done some wonderful work, and you'll see that unfold on LinkedIn and social media in the weeks to come. But one of the key successes within that organization was launching it from their top senior leaders, because things happen more
Mhm.
quickly and your program rolls out more quickly and you gain the support at all levels of the organization. So having that senior leadership buy-in is really important. But unfortunately, what we're finding also is that less than 15% of organizations have any type of menopause support. It's up from 4%. So on one hand, we can applaud, right? We're increasing, but yet only 15% of organizations have anything in place. And if you say, Dr. Hansen, are you menopause friendly? Oftentimes, if they have a benefit or they are covered by insurance, that's what they think menopause support is.
Mm.
And it's really, I mean, to come back to that cultural change, when you're changing culture, it's not a one and done. It can't just be a checkbox. It can't be that tick box that you check and yes, we've done the training and education, so now it's over. If you really want that sustainable cultural change, it has to be weaved into the breadth of
Mhm.
the organization, and that takes time. I often think about it as kind of a puzzle. And if you were to imagine the women within your organization that are menopausal, and that's the front of the box, right? They're thriving, they're doing well, they're happy, they're healthy. That's the puzzle that we're trying to put together as an organization. And what we find is that oftentimes organizations will start with the corner pieces or the outside edges, because that's what we all do when we put a puzzle together. That's the easiest, right? These are the pieces that make the most sense. But sometimes we're not feeling in the middle. And that's
Mhm.
where the real hard work happens. And those are the small changes that you can implement within an organization that are really important. So it's your working environment, it's the culture, it's serving your employees to actually ask what do they need, and then doing something with that information and pivoting and making changes. Employee resource groups, community groups, support groups, though there's so much that organizations can do. Then we really hope with sessions like this that organizations sit up and they take notice, because women 50 plus are the fastest growing workplace demographic in the US today. And millennials are bumping up against perimenopause right now. So average age, right, to start perimenopause is 41, 42. And you mentioned the length of time that the average is 5 to 7 years
Mhm.
to sit in that perimenopause stage. That's where we see symptoms begin to present. Millennials are coming up into that perimenopause stage. And so
Mhm.
now you've cast your net even wider. So it's really important from a retention perspective with organizations to support the women in the workplace that are in menopause right now.
Mhm. Wow, yeah, you just wrapped a beautiful bow around, what organizations really need to do, and you talk about weaving into the middle of that puzzle, how truly transformative that would be, and again, for the women, for the humans, and also for the bottom line.
Right.
So as we start to wrap up, really wanting to make this tangible for our listeners. I heard you sort of listing some things that you think are really vital for accreditation. I'm wondering if you could even just kind of bullet it one more time for us so that anybody that's listening, that's jotting down notes, like what do they ask their organization, or if they're business leaders, what are they exactly looking for? And then, of course, they can reach out to MiDOViA for further accreditation support. Can you bullet that out for us?
Yeah, absolutely. First, I want to mention that there's a free checklist on our website, and you
Beautiful.
can download that, and that really is a great roadmap.
That's
Uh,
exactly what I was looking for.
okay, good, good.
Thank you for producing that.
You can just download it. In the conversation with the organization this morning, they mentioned how beautiful that was, because it truly was the roadmap. They identified the gaps and then they worked on the gaps to fill those. So I would encourage everyone to download that. But really quick punch, we're looking for 5 areas. We're looking for training and education, policies and practices, which most organizations are calling guidance documents now, not necessarily policies. Training and education, we already said that. Working environment, employee engagement, and then overall culture, which really the 4 previous aforementioned categories all roll up into culture, right? So you can picture culture really holding those other 4, because
Mhm.
once you implement the other 4, your culture naturally changes. That's hard to say on a Friday
Yeah.
afternoon. But culture really holds those other 4 categories. So that's it in a nutshell. It's not necessarily that simple, but
Right.
those are the 5 areas that organizations can look at.
Right. Amazing. Thank you. And I love how you're emphasizing over and over again, this really has to be involving the leadership, not a top-down approach necessarily, and a,
Not
a
necessarily.
conversation, a collaboration, a partnership, but the leadership needs to be involved. And we just had a question come across the screen, what's your favorite way for an organization to evolve? And
Mm,
I keep coming back to what I hear women say, which is flexible
right,
work time, flexible work hours. I mean, we know, you and I know, we're working way, way, way more than 8 to 10 hours a day, way, way
right,
more than 40 hours a week, right? Like, we're working those hours, but to be able to do it with an ebb and flow of what's natural for us. Do we start later in the day? Do we start earlier
right,
and finish earlier? Like, my brain doesn't work after 7 p.m. anymore. So
right.
I need to be done, and I can start at 5 a.m. So, like, if I could just do that with my workplace, that would be my favorite way for an organization to evolve. And yeah, I'll let you answer. We're getting some questions
Yeah,
coming
we're
in.
getting some questions.
Yes, what is
How do I get my company to care about menopause? I say this time and time again. There was a study that came out in 2023 that noted the number one reason why organizations are not folding in menopause support programs is because employees don't ask. They
Mhm.
have no idea that their employees want or need menopause support. So I would say use your voice first and foremost. Speak up and ask because you don't know what you don't know until you know. I would also recommend going to our website, drop down on resources. We have an entire landing page that's everything you ever needed to know and to take to your HR department to have that conversation with them about folding in menopause support in the workplace. So speak up and use your voice. As I used to say to my daughter all the time, let your quiet voice roar. Go roar.
Yes, I love that. I'm going to use that. And I'll ask our moderators to put the websites in the chat. So
Great.
MiDOViA.com, PandiaHealth.com, drcatherine.hansen.com. So these are places we're going to continue this collaboration, and we are going to continue to unpack this conversation around the business case in two more sessions coming, one at the end of March and one at the end of May. So lots of time for us to get together. And so there is a question I'll get to in a second, but I just want to wrap up. I feel like, I really want to hit some highlights and make sure that we sort of wrap up this conversation, and then I'll answer the final questions coming in and give you a chance to do the same, April. Um, so if I can summarize, we talked about what menopause is and what it means for women individually. And I think we promised on this call also to talk about specific treatment options. So I'm going to hit that really quickly. There are treatment options available. So pandiahealth.com is the best place to go for an assessment or a credible menopause certified practitioner. You can find menopause certified practitioners on menopause.org, and that's the Menopause Society site. And menopause treatment, it comes in non-prescription, so natural integrative approaches. It comes in lifestyle changes. It comes in prescriptions, hormones, non-hormones. There's many, many options. The mainstay of menopausal hormone therapy is estradiol and micronized progesterone. And depending on whether a woman has a uterus or not, she needs the progesterone with the estrogen. There are a lot of people out there saying that there are other treatments required. And so each person is individual and needs to really be vetting that advice they're getting. So making sure that you're talking to your healthcare provider about that. And then if your company doesn't have access or can't help you get access to a menopause provider, then that's what we're doing here. We've got MiDOViA to talk about menopause accreditation, training, and support. We've got Pandia Health to actually bring treatment options into an organization. So we promised to cover that. Now I feel better about that. We moved into why we care, the stigma, and how essentially the main theme here is that having the conversation, raise your voice, use your voice, talk with colleagues, talk with business leaders talk with your employees and your staff, just opening the conversation. It's time that we have that conversation. And then you gave us the bullets around how to really start to shift culture and how to weave these beautiful relationship related conversations and culture change into an organization. So I'm just going back. There was a comment that came through and it said, Basically, it said Japan, South Korea, and Spain have policies in place for menstrual paid leave. More organizations need to join the conversation around the subject, reflecting a growing awareness of the need for workplace support. Yeah, thank you so much for that comment. And we are noticing a lot of resources coming out of the UK. And
Yes.
so handing over to you again, if there's any wrap up pieces or further points you want to make, and then maybe a shout out to some of your UK colleagues and resources that you have been using at MiDOViA.
Yeah, absolutely. I mean, the UK is 9 years ahead of us in the menopause space. So we are seeing policies and practices in place that protect individuals that are going through menopause. Australia just passed new legislation. So bravo to our Aussie friends as well. I think, again, it comes back to having the conversation, asking, using our voice. We have to advocate as well at the policy level. I don't want to take it into a political conversation here today, but it's going to be even more so, more important for us to have those conversations with our local legislators and to demand better care for menopause support and just women's health in general. So contact your local legislators for that. And I would say a good place to start in organizations is to make sure that they have menstrual products in your bathroom. Make sure that you have access to those, that you have access to bathrooms, that you can actually go take a break if you need to change your pad. Those are simple things that aren't even in place with organizations today. So start small and build from there.
Mm-hmm.
Absolutely.
And I agree about not taking it into a political conversation, but as I'm reading all of the data and stats, I'm acknowledging that if money is trying to be saved, we could save 26.6 billion in lost productivity by providing support for the menopausal demographic in the US alone. The numbers are even bigger globally, and if you include Canada, bigger. So that's US data. The 1.8 billion in lost work time due to menopausal symptoms we mentioned already, and 40 plus demographic, 25% of the workforce. So the
Yeah.
demographic between 45 and 55 years old, which are our peak performers,
Right.
are 2 million women experiencing menopause. And I do find myself feeling like, as we're having this conversation, we're asking women to do more. And so
Mhm.
this is why I want to applaud you for bringing the conversation in about men, because really our male colleagues can be the ones who are advocating for us. So allyship
Yes.
is really an important resource and tool for us to be changing culture and to be willing to have conversations with the men and the women and the non-binary and like everyone in the workforce, really being willing to say, this isn't just this woman's problem, or
Right.
it isn't just, this demographics problem. It really is a whole company level, global, world level uh,
Yeah.
challenge that has a silver lining, because as we change the conversation, as we improve the culture, as we imagine the vision that you set us on when we first started this conversation, the vision being that women are thriving and that organizations are therefore thriving on the heels of that success.
Yeah.
So it has been such a pleasure to have this conversation with you. For all of our listeners, thank you for coming, for the questions and comments. We're deeply grateful. We have put all of our links and information in the comments, and I'm just really, really grateful to be able to continue this conversation with you in our next session. April, thank you so much.
Looking forward to it. Thanks so much, Dr. Hansen.